We are moving on to our next session. The next session I have been personally waiting for it for a long time. She's an NRB. I mean, she used to reside outside Bangladesh, but she had an education in US, decided to come back and go into a completely new sector, unventured, where I will be saying that the journey is not very smooth. And that's the health sector in the country. Let us welcome Ms. Sylvana Q. Sinha, ESQ, and she's the founder, managing director, and CEO of Praava Health. Please come on the stage. Just to briefly introduce you, Praava Health is a network of family healthcare centers, and they're basically building small healthcare centers across the country, I suppose. My question will be to you, what made you come back? And what made you take this awesome journey? Thank you.
So just to clarify, actually, for me, it wasn't coming back. I was born in the United States, and I had actually never lived in Bangladesh before in my entire life. I had visited often, and my visits to Bangladesh as a child, actually, I was very affected by them. When you're an American and you visit Bangladesh, you get very affected by the poverty, frankly. It's jarring to see it as a child, and I was very fascinated at, frankly, how differently my family lived as opposed to, what I saw the masses and how they were living. And so I worked I studied development, and when I was in college, I did some internships both in Washington and US foreign policy, as well as here in Bangladesh at the Grameen Bank and at a law firm. And I ended up pursuing law and development. I studied international law at Columbia.
So a lawyer who turned into healthcare.
Yes.
Okay. I'll leave the stage to you, and let's hear her journey. Thank you so much.
Thank you. Thank you. So I also studied international development. I did my master's at Harvard, and I was very interested in development economics and in the US's role in international foreign policy, and worked for many years in international law and development at big law firms in New York, as well as at the World Bank, and in other countries, in Afghanistan, the Middle East, Thailand, and beyond. And had spent a lot of time looking at development challenges in particular, and learned a lot of things, but was kind of not feeling connected to the impact of the work that I was doing. So a few years ago, I was about 10 years out of graduate school and started thinking about what I would do for the rest of my life. And had always wanted to do something for Bangladesh, but didn't know what that would be. And also maybe in my mind, I thought it would be later in life. But I was doing some advisory work and looking at growth markets, emerging markets, the opportunities there. We have, I think more than 66% of the global middle class actually is living in Asia now. There's tremendous opportunity. And started thinking, well, if I'm going to be doing this kind of work, why don't I actually look at the country where my parents actually came from, the country that I have the strong connection to, Bangladesh. When you look at health in particular, I knew very closely and intimately some of the challenges facing the health sector in this country. My mother had, at my cousin's wedding about 7 or 8 years ago, maybe 9 years ago now, my mother had an emergency appendectomy at one of the top hospitals in Bangladesh, and it was frankly a botched surgery. They waited too long to do it, and then after they did it, there were a lot of complications. And we had to airlift her to Bangkok, and she had to have another surgery there. A year later, another surgery in the United States. This was just one story, but we have access to some of the best healthcare in the country. And so my mother and my family and I, we always say, how are most people handling it? Most people can't afford necessarily to travel to Bangkok or beyond to address the health needs that they have. So I knew there was a need. I didn't know what it was. So I started out on what I call kind of a listening tour. I met with anyone who would talk to me, both here in Bangladesh as well as abroad, to learn from what had been done in health. And the fact is, actually, even in the United States and in some of the most developed countries in the world, people are grappling with the challenges of providing health care to their populations. So no one has really cracked the code, but some countries are definitely doing better than others. And Bangladesh is doing very well in some ways, actually. There's tremendous reason for hope. On social development indicators, Bangladesh is doing better than any other country in South Asia. I think in the rural areas and in the in the community clinics level, to the government and the NGO community's credit, actually, there's a lot of progress that's happened when it comes to basic indicators like maternal mortality, child mortality, vaccinations, and the like. But when it comes to anything beyond that, and specifically in the urban setting, the challenges are really tremendous. And when anything beyond the most basic care, people do tend to prefer to access the private system. And so when I was on this listening tour, I learned two things. One, there's definitely a huge gap when it comes to quality. There's only one internationally accredited lab in the whole country. And as a result, many of you, I'm sure, can also personally attest, it's not uncommon to send out 5 samples of blood and to get back actually 5 different results. Despite that, when you ask patients why they're traveling abroad, and specifically, I was interested in the middle income segment of the population, which is the segment that cannot afford to jet off to London for a surgery. They're generally traveling to India, actually. And every single day, the Indian embassy issues 1,000 to 2,000 visas for medical reasons alone. So these are people who cannot necessarily afford to even make the trip, but they're doing it. And when you ask them why, the number one thing they talk about is not quality. They actually talk about trust. They say that, the doctor in Bangladesh doesn't make eye contact with me. The doctor in Bangladesh is not answering my questions or listening to me or even smiling at me. And these are very basic things, but they're actually fundamental to the treatment, to someone's health treatment. And there's evidence that when patients actually engage with their doctors in managing their care, you get improved health outcomes. A survey was done this fall by the British Medical Journal that was published in November, and they basically surveyed 67 countries to see how much time doctors were spending with patients. Bangladesh was number 67, 48 seconds per patient. India, when you tell Indians that people are traveling to India because the doctors there spend more time with them, they laugh at me. But India is actually 2 minutes. So that's actually more than double on average, and these are the margins that we're pushing up against. So this is where basically I started out. In the process of spending time, meeting people, anyone who would talk to me, I started to build out a really incredible team. I think a lot of the things that have been shared today really resonate with me. It's challenging to do anything in this country, but I believe that nothing worth doing is easy. And so I think human capital is the biggest challenge we face in terms of scaling a healthcare organization. But there are really good doctors in this country. And we started out in the urban setting very intentionally. The best doctors in the country actually want to live in Dhaka. And so we've had less of a challenging time recruiting talent than we thought. We've also been very lucky to be able to tap into the NRB community. I myself am the child of Non Resident Bangladeshis. My senior director of cancer diagnostics is a cancer immunologist who runs a lab at Harvard Medical School. My IT director was with IBM in the United States for 14 years. My chief innovation officer, she is an actuary by training who worked in the UK and the US for many years. She's one of actually only a handful of actuaries in the country. And in terms of our doctor pool, actually, every single one of the doctors who works for us has spent at least some time practicing and training abroad. So we've been very lucky in many ways in terms of attracting some really incredible talent. And part of that, I think, is related to the hope and the optimism that people have for the future of this country. And to the belief that there can be a better way. So, one of the things I want to share with this audience in particular is, the concept is family doctors and diagnostics, as I've mentioned. But one of the products that we're offering is membership plans, which are basically like outpatient insurance packages. Insurance is really nascent in this country. Only 0.12% of the population has any form of insurance, and most of that's actually life insurance. The health insurance that exists is generally for inpatient care. So we've created insurance packages for outpatient care. So basically you can sign up for yourself or your loved ones. If you don't live here, you can buy, if your mother has diabetes, you can purchase a membership plan whereby she can have all of the tests she requires over the course of a year that you've paid for upfront. And actually, for diabetes, I think the membership plan is about 25,000 taka, which is quite affordable for a year of all of your tests and unlimited access to our doctors and health coaches. So this is something that I hope that the NRB community can help us to promote, and even I hope that you'll consider purchasing these membership plans for your loved ones. We're always looking to build out our international partnerships. We've signed an agreement with Harvard Medical School to train our medical professionals on diabetes care. We've signed another agreement with a company called LifeTrack, whereby patients can actually have their scans reviewed. So you can get second opinions from doctors sitting all over the world. You can pay a little bit more of a premium for a US board-certified radiologist. So these are the types of partnerships that we'd love your help in either introducing us to or actually following up and helping to build out. I think that's all, unless anyone has any questions. I'm happy to talk about this all day, but I don't want to bore you guys.
Hi, I'm Kamrul Meena from Austin, Texas. I'm in software, but I hear a lot of health-related issues, our enterprise in Bangladesh. So my question is, first of all, it's very interesting what you're saying, on the healthcare side, that you're providing insurance and so on. But I'd like to ask, how did you start the organization? Where did you get your first funding? And where do you want to take it? 3 things. Thank you.
Great question. Wait, what was the first one? Sorry.
How
did I start?
How did you start it?
Okay.
Where did you get your first funding? Where do you want to take it?
Okay. So how did I start? So basically, I just started learning everything I could about health. I was not a healthcare person, honestly speaking. I was a development person. I knew that there was an opportunity. I knew based on my work in development that private sector interventions in infrastructure can help to alleviate poverty, and I knew that health wasn't the area that I wanted to focus on. I started talking to people here and really connecting with people who were working on similar things or who were familiar with some of the challenges. And like I said, I would really meet with anyone who would talk to me. I was pretty busy for a while and still am, but I think the first funding, I engaged a firm to help do a financial model. And I did a lot of the legwork as well in terms of gathering original research on actual pricing and trying to understand how much it would cost to get this off the ground. I self-funded initially for the very first part of it, but I brought in funding in 2016. I have all individual angel investors, a few NRBs actually, mainly based out of the United States. The investment structure is done in a way that's favorable to Americans because I'm an American and most of my investors are as well. So we have a shareholding company in Barbados, and then there's a Singapore company, and then Bangladesh. And then, sorry, what was the last question? Oh, what's the plan? So the plan is to basically roll out more than 30 facilities between mainly Dhaka and Chittagong. We're basically utilizing technology to increase efficiency in the system. And the future of medicine is actually technology. I think that everyone has been talking about AI. I think we're far away from those things actually being able to have a huge impact on day-to-day practice of medicine, but that is where the future is headed. And so we believe, because we have brought Bangladesh's first fully integrated hospital information system, there's a huge tech component. We're going to have access to a lot of data. We're going to understand how people are accessing our membership plans in this value-based model that we've brought. Over time, using data and technology, I believe we're going to be able to increase access to specialty care, which is, I think, something we can do from day one. We actually have a telemedicine unit in our facility, so you can actually do video consults with doctors sitting abroad. And that basically, a doctor can in real time listen to an EKG that's being done to a patient. So using technology, I believe we can achieve even more than beyond the 30 facilities. I think that we believe we'll be able to serve millions of patients over time. So the sky's the limit. By my calculations, to get Bangladesh just to India's level of healthcare would require $17 to $20 billion of investment. So if I can have $1 billion of that, I'll be very happy.
Okay, last question. We will still give you a microphone.
Thank you. I'm Monica Jahan Bose. I'm actually based in Washington, D.C. Congratulations. I think you're going to have a lot of customers, probably including my mother. We've been facing this. She decided to retire in Bangladesh after many years abroad and is facing the very sad choice of having to go back to the U.S. because she's had such terrible health experiences here and had to essentially, had to leave the country several times because of total misdiagnoses. And so this is very encouraging, and I wanted to congratulate you, and I'm really excited to also see a woman on stage. I've been a little dismayed at the lack of gender diversity up there. And also, just wanted to see how your experience has been. How has it been being a woman entrepreneur in the still male-dominated world? Thank you.
কোনটা মেল ডমিনেটেড ওয়ার্ল্ড বাংলাদেশ
I said world. I didn't say this country. I said
আমার ছোটবেলা কেটেছে হচ্ছে আমার বোনের অত্যাচারে মাঝের বেলা কেটেছে আমার মায়ের অত্যাচারে এন্ড বিয়ের পরে আমি জীবনে টেলিভিশন চ্যানেল পাই নাই বাচ্চা হওয়ার পরেও পাই নাই আমার দুই মেয়েই টেলিভিশন চ্যানেল রেখে দেয় এন্ড উই আর রেগুলেটেড উইথ শেখ হাসিনার মতো such a gutsy prime minister mashallah but yes jokes apart I would like you to
Sure.
go ahead but আমার কাছে আমার পার্সোনাল এক্সপেরিয়েন্সটা বলি মানে যারা বাইরে থেকে আসছেন আমি তো ধরেন এই মানে 18 বছর প্লাস কর্পোরেট ক্যারিয়ারে আমি কিন্তু দেখেছি I have worked with 33 different countries I'm telling you I've met with people from everywhere and I'm telling you Bangladesh এই সাবকন্টিনেন্টে is possibly the most progressive country when it comes to career for women in the corporate world I'm telling you period.
So that's a great question. Thank you for your kind words as well. I think that it's hard to be a woman in this world, period. I mean, but I don't like to focus on it that much, to be honest. Sorry? Oh, I mean, I don't like to focus on it that much. I mean, I think that there are challenges. And I think mainly, you get underestimated. But I don't really mind that because, like, I prefer just to do the work and let it speak for itself. And if people want to underestimate me, like, it doesn't really affect me necessarily. I do think there are certain systemic things you need to do to help to kind of imbue respect. Like, I have a lot of men who work for me, and I bring them to meetings. You know, I think that those things are important for people to see that dynamic between you and your colleagues in order for them to understand that they should respect you. But I think that I think that it's not that bad. I mean, I worked in Afghanistan, and I have to say, before I had worked in Asia substantially in my life, I had not felt that. I think you can actually use being a woman to your advantage in this part of the world, in that there's a level of respect that women get, whether it's real or fake, I don't know, but like at least in front of you, they will pay you a level of respect that you don't necessarily even get in the West. I'm recruiting someone actually to be our chief strategy officer. She's a white woman, and she's American. And she was telling me, she lives in America, and she's very frustrated with everything that's been happening in the United States lately when it comes to women. And I mean, it's wonderful that people are talking about it, but there's still a lot of kind of anger, I think, that a lot of people have. And she said she was telling her husband, she said, you know what, people here, they're so disrespectful to me in the office. She said, you know, Sylvana's employees, they don't smoke in front of her. And it's not because someone told them to, it's because they respect her. And those things, like, we don't ever think about it that way. And I never even thought about it that way. But I thought, wow, that's actually true. She said, and she gave that as an example to her husband about how she thinks it's going to be better for her here. I don't know, like, you know, everything is conditional on your own experience individually. But I've had very positive experiences overall.
Thank you so much. Thank you so much. One round of big applause
Thank you.
to Ms. Sinha, and thank you. Best of luck to Praava.
Thank you
Thank you
so
so
much.
much.